PCOS can often be a silent struggle, as you may have had the symptoms for years. They can impact your daily life in many ways. As a doctor, I often see patients who've been struggling with this condition for years without being diagnosed. They know that things are not quite right in their body, but they don't understand why. So in this video, I'm going to explain to you what the symptoms are and what the causes are, so you can be better informed about your health. PCOS can play havoc with your hormones and therefore affect a lot of your day-to-day life. Many of my patients have had symptoms for years without being diagnosed. So would you know how to spot the symptoms? So what exactly is PCOS? PCOS is a condition that affects a woman's hormone levels. Women with PCOS produce a higher than normal amount of male hormones called androgens. The most commonly known androgen is called testosterone. This hormone imbalance can have many effects on a woman's body, including causing her to skip her periods, and in some cases it can even impact fertility. PCOS affects a woman's ovaries. The ovaries are two organs which are really important in female reproduction. Your ovaries produce hormones like estrogen and progesterone, which go on to regulate your period cycle. If you're having higher than normal amount of male hormone called androgen and you're having a smaller amount of estrogen, this hormone imbalance can therefore affect your ovulation, and this causes many of the symptoms associated with PCOS. Polycystic Ovary Syndrome is a combination of symptoms. Its three main features are cysts in your ovaries, high levels of male hormones, and irregular or skipping periods. In PCOS, in your ovaries, you may develop many small sacs. The word polycystic means many cysts. Because of the disruption in the hormones, it's thought that many of these follicles, which contain your eggs, never fully mature properly as they should, and therefore you may not ovulate. So what exactly causes PCOS? We don't know the exact causes of PCOS, however, it's thought to be linked to the excess in male hormones. And there's many different factors at play, like genetics, insulin resistance, and inflammation, which are all thought to have a role. I recently saw a patient called Maria who came in to see me because she was worried about PCOS. She said that her mum, who had PCOS, had a hard time conceiving, and she wanted to know all the essential information. Well, this is important to note because genetics are thought to have a role. Studies have shown that PCOS often runs in families. However, it's thought to be linked to many different genes, not just one gene in particular. In Maria's case, she did need some support with her fertility and went on to have a healthy baby. Another contributing factor to PCOS is thought to be insulin resistance. It's estimated that around 85% of women with PCOS are thought to have insulin resistance. This means that your cells are not producing insulin properly. As your cells are not able to use the insulin properly, to compensate, your body then tries to produce extra insulin. The excess insulin therefore causes your ovaries to produce even more male hormones than it would normally. This can then contribute to weight gain or obesity. Common symptoms of PCOS. Some women start to have PCOS symptoms around the time of their first cycle. Other women may only find out they have PCOS when they're trying for a baby, or they're gaining weight or having irregular cycle and they're not sure what's going on. I recently saw a patient called Gabby, and she said she'd been struggling with her mental health. She felt her weight was unable to manage and was impacting her confidence, and she felt like she had excessive hair growth. Once Gabby was diagnosed with PCOS, we were able to get her some support to help better manage her symptoms. The most common symptoms with PCOS are similar symptoms to what Gabby had. Some women are skipping periods, and other women may notice that their cycle is irregular. Some women are experiencing heavier periods than normal. Hair growth. A lot of my patients will notice that they're hairier than what they would expect or their friends are, especially on their face. Acne. Male hormones may make your skin oilier and therefore more likely to develop acne. This is especially noticed in areas like your face or your back. Weight gain. A lot of my patients come to see me with struggles of weight gain. They often say to me they've tried a variety of methods to help maintain their weight, but it just never seems to get under control. Male pattern baldness. Hair on the scalp may get thinner or even fall out. Darkening of the skin. Dark patches on your body can form in skin creases, like those of your neck and groin. How is PCOS diagnosed? Knowledge is power, and often with my patients, I wish they'd come to see me earlier. They'd often had concerns for years, but I am happy about the increased awareness of PCOS. Once you know you have PCOS, you can take steps to help manage your symptoms. Doctors tend to diagnose PCOS when you have 2 out of 3 of these symptoms: high androgen levels, which is high male hormones, irregular period cycles, cysts in the ovaries. That's why it's called Polycystic Ovary Syndrome. As a doctor, I'll start by asking many different questions about your periods, about your cycle, about acne, and see if you've got any symptoms of PCOS. Then we may organise further tests like blood tests or a scan to see if you have any cysts, or to see if we have increased levels of male hormones in your blood tests. In my next video, I'm going to go through the best management of PCOS symptoms. Here are some common questions that my patients often ask me. What are the symptoms most commonly associated with PCOS? Does PCOS affect my fertility? As I've explained in this video, PCOS can affect your ovulation, which is when you release eggs. As you need these eggs to get pregnant, it could impact your fertility. PCOS can affect mental health, often due to the physical symptoms that you may experience. Does PCOS affect mental health? Well, often with my patients, I have found that their mental health can be affected. They've often struggled with acne and weight gain and fertility struggles, and these can have a profound impact on your daily life. However, I do believe that knowledge is power, and once a woman knows she's got PCOS and can take the right steps to manage her symptoms, I think this can have a huge benefit for her mental health. Can PCOS be cured? Right now, there is no cure for PCOS, but research is ongoing, so watch this space. Instead, we're focusing on managing the symptoms associated with PCOS. With the right treatment and lifestyle changes, many women notice that their symptoms can be effectively managed. What are the long-term health risks of PCOS? PCOS is linked to type 2 diabetes, high blood pressure, and heart disease, but the good news is, if we manage your symptoms well, we can reduce the risks of these conditions. The summary is, PCOS is thought to be linked to an increased level of male hormones called androgens. Common symptoms can include ovarian cysts, changes in your period cycle, and excessive hair on your face or body. With the right treatments, we can effectively help manage your symptoms. So please see a doctor if you're struggling, and don't struggle at home alone. If I can ask for a favor, if you click the word subscribe, it really helps my channel to keep on growing. If you can write a comment down below about your experiences with PCOS, we can keep the conversation going. Knowledge is power. Thank you for watching today's video.